What is CIN and how is it linked to HPV? Imagine your cervix as the gateway between your uterus and vagina. Sometimes, cells on the surface can change in ways that are not normal but not yet cancer. These changes are called cervical intraepithelial neoplasia, or CIN. CIN is a way doctors describe abnormal cell growth that could turn into cancer if not caught early. They grade CIN from 1 to 3, with CIN 1 being mild changes and CIN 3 being more severe, almost like a precancerous stage. The main cause of CIN is infection with the human papillomavirus, or HPV. HPV is a very common virus that spreads through sexual contact. There are over 100 types of HPV, but only some are considered high risk because they can cause changes in cervical cells. High-risk types like HPV 16 and HPV 18 are most often linked to CIN and cervical cancer. Most HPV infections go away on their own because the immune system clears them naturally. But sometimes, especially with high-risk types, the infection persists, and that's when problems can start. Persistent HPV infection can cause the virus to insert its DNA into the cells of the cervix. This process can interfere with how the cells normally grow and divide. When the virus integrates its genetic material into the host cells, it can turn on genes that promote abnormal growth and turn off genes that normally prevent cancer. This disruption can lead to the development of CIN. The more the virus integrates into the cells, the more severe the abnormal changes tend to be, which increases the risk of progressing to cervical cancer. Detecting CIN early is very important. Doctors usually find it through pap smears or HPV tests. If high-grade CIN, like CIN 2 or CIN 3, is found, treatments such as removing the abnormal tissue with procedures like loop electrosurgical excision or cone biopsy can prevent it from turning into cancer. Factors like smoking or a weakened immune system can make it more likely for CIN to develop into invasive cancer over time, so managing these risks is also important. In summary, CIN is a precancerous condition caused mainly by persistent infection with high-risk HPV types. The virus's ability to insert its DNA into cervical cells triggers changes that can lead to cancer if left untreated. Regular screening and HPV vaccination are powerful tools to prevent CIN from developing into cervical cancer. If you have concerns or need personalized advice, it's always best to consult a healthcare professional who can provide guidance tailored to your situation.